So our next part is about classification of aminoglycosides. In the classification, you can see there are various types of classification is there. That is based on the that is RA means route of administration, the therapeutic application. Next one is that is adverse effects which are causing. Then about the antibacterial spectrum of activity, we can antibacterial spectrum we can classify. That is the third classification. Fourth is based on the that is the adverse ADR effect. They can be classified. They can also be classified based on the ring system. So it can be classified based on the ring system also. So there are basically 5 types of classification or 6 types of, that is those which is having a deoxystreptamine can also be based on that. That is that can be classified according to the that is based on that is ring system in which we can include. So basically they are route of administration, therapeutic and adverse drug reaction, antibacterial spectrum of activity or the ring system which we are present in aminoglycosides, where which we are classifying the drugs. The first category is the route of administration. We have the local as well as systemic type of drugs are there. Local means example is tobramycin. So tobramycin, you know that they are usually given in the form of eye drops, as well as kanamycin is there. Kanamycin injection is also available. That is parenteral route also this kanamycin is available, and locally they can be locally we can give this one, that is kanamycin. And systemic, the main drugs under systemic is gentamicin, amikacin, streptomycin, etc. So gentamicin is also given as that is eye drops and all genda in the brand. So for systemic also gentamicin, amikacin, streptomycin. Streptomycin is mainly given in the form of this parental route. So there is a classification. It can be classified in local as well as systemic type. And the therapeutic type of classification, that is for which infection it is mainly given. It is tularemia, we can majorly, that is streptomycin can be given, but especially for that we can give gentamicin. Then enterococcus infection we can give genda as well as streptomycin, and also pseudomonas infection we can give tobramycin for as a drug of choice. Okay, based on antibacterial spectrum, they are having both for gram positive as well as gram negative. They are gentamicin, kanamycin, neomycin, tobramycin can be given for both the gram positive and gram negative. Especially for gram negative, we can give amikacin as well as streptomycin. So amikacin is a semi-synthetic form of drug, and the rest of the species usually of the that is in the case of aminoglycosides are obtained from the species Streptomyces species from which we are obtaining this aminoglycosides. And the semi-synthetic form of the drug is that is amikacin. And based on the adverse drug reaction, we can classify it into basically on cochlear damage we have amikacin and gentamicin. And for vestibular action, we are having streptomycin, tobramycin as well as for gentamicin. So these are the drugs which mainly causes vestibular damage, and all these points, that is how their action is very important in the case of Viva as well as for your that is MCQs and all. And another one classification that is based on medicinal chemistry is the ring system that is available in the aminoglycosides. So based on the ring system, we can classify this aminoglycosides into those which is having a streptidine ring system and those which is having a 2-deoxystreptamine ring system. That is streptidine ring system, that is especially for streptomycin. We know that what is streptidine. So streptidine is a that is cyclohexane ring where we are attaching to that is guanide. So we can call this biguanide ring that is occurring in this structure, that is inositol structure is streptidine. And this 2-deoxystreptamine structure is, if it is our skeleton is there. The examples are gentamicin, tobramycin, neomycin, amikacin and kanamycin. So these are the drugs which is having that ring in the system, ring in the structure, that is 2-deoxystreptamine. Examples are gentamicin, tobramycin, neomycin, amikacin and kanamycin. For streptidine, we are having streptomycin. So these are the general classifications of aminoglycoside antibodies. They can be classified based on the route of administration. They can be classified based on the adverse drug reaction. It can be classified based on their, that is, ring system that is present. It can be classified based on the adverse drug reactions, antibacterial spectrum of activity. All these types we can classify this aminoglycosides. So this uses of aminoglycosides, they can be used in septicemia, they can be used in pelvic as well as abdominal sepsis. Then they can be used for the bacterial endocarditis, then pneumonia, plague, brucellosis also we can give this drug. Then acute conjunctivitis, phlebitis, all these things we can use this aminoglycosides. So can be used in septicemia, pelvic abdominal sepsis, bacterial endocarditis, pneumonia, plague, brucellosis, acute conjunctivitis as well as phlebitis. All these things we can use aminoglycosides. Septicemia is usually that is the presence of a large amount of bacteria in the blood. They can be called a septicemia. And the sepsis of this pelvic as well as abdomen also we can give this aminoglycosides. Coming to the area of aminoglycosides, so adverse drug reaction commonly causes ototoxicity. So they can be caused vestibular as well as that is cochlear type of, and the cochlear type of that is adverse drug reaction can occur. That is this occurs usually due to when the concentration of this drug in the plasma is so high, and this may leads to irreversible type of deafness also associated with the ototoxicity, and vertigo as well as a loss of balance is usually in patients receiving this type of drug, that is usually aminoglycosides. Then they also causes nephrotoxicity, and that is mainly related to calcium mediated transport. So calcium transport mechanism where this is mainly acting, and this in the case of neuromuscular paralysis also they will occur. That is, it can be intraperitoneal or intrapleural administration of this drug. Then usually they are more risky to MI patients, that is myocardial infarction patients, where this aminoglycosides are making more problems, and they are also causing allergy, dizziness, skin rashes, vertigo, etc. These are the common adverse reaction of aminoglycosides. Whenever you are thinking of aminoglycosides, you should remember about ototoxicity as well as nephrotoxicity. It's a major type of adverse drug reaction associated with aminoglycoside. They are ototoxicity. They can be cause that is irreversible type of deafness also, and the nephrotoxicity by means of calcium transport mechanism and neuromuscular paralysis, and it is high risky for myocardial infarction patients. Also allergic responses, sometimes it may cause a super infection also, as well as dizziness, skin rashes, vertigo, etc. The common adverse drug reaction of aminoglycosides. And the next thing we have to study is the mechanism of action of this drug, that we will study in detail.